Hello everyone, this is Dr. Hasna, brought to you by UKPass Academy, and today we're doing the teachings. Alright, so let's talk about the basic approach of teaching first, and then we'll proceed to our guy over here, Mr. Michael. Say hi, Mr. Michael. Oh, he's dead. Let's revive him by BLS. Alright, so first things first, whenever we do teaching, our approach should be the 4W approach, meaning you need to gather some data from the student that's in front of you, whoever has come to learn from you, right? So the 4Ws are basically gathering what they already know, what they want to know, when do we do it, and why do they want to learn it. So the 4Ws translate as, if you could bring that closer, it's what already, this is how you're going to remember it, what, want, when we do it, why would you like to learn. Now once again, make sure these questions are made in your own dialogue. It shouldn't be what already know, what want know, when no, don't do that. Make up your own dialogue for it, like, so how much do you already know about it, right? What would you like to know in anything in particular you want me to discuss about it? Do you know when we do it? Do you have any idea when we do it? And finally, why? So why is an awkward question? Why do you want to learn? How dare you question them? So for that, I usually tell that, is there any particular reason you're looking to learn about BLS? By any chance, you can make it up in your own dialogue. Alright? So these are the 4Ws. Once you've asked this, make sure at any point he's given you an answer. For instance, when do we do it? And then he says, he's unresponsive. That's when you say, well done, excellent, brilliant. So have these words in your mind to always appreciate the person you are teaching. Alright? So, well, do you know why? Is there any particular reason why you want to learn this today? Yes, I have my exam coming up and they're asking me to do it. I have some course coming up, some ALS course, so I need to learn how to do it. So it could be any reason for BLS teaching. So just say, oh, that's wonderful. You did the right thing by coming to me, and I would love to teach you, okay? And always remember, guys, before the 4W, don't forget your rapport, okay? Always, whenever there's anyone that's coming to study with you, you don't just directly go into what you already want to know, what you want to know, who are you, okay? No. First, you build a base, okay? How is everything going? How are your medical rotations going? Whatever, depending on the person that's in front of you. Alright, now let's move to the BLS teaching, alright? So, whenever BLS teaching begins, you have to basically teach the person how to do a BLS. Alright, so let me go through a basic approach of BLS. So we have BRS, we have doctors, and then we have ABC. Alright, so doctors ABC goes like, first you have to go and check the danger. First, whenever you go to the person that has fainted, you look for danger, you make yourself safe. Okay, any safety, any danger, you do that. Next is R, you check for the response. Alright, so when you check for the response, you tap on the shoulder and you say, what was his name again? Michael. Michael, are you okay? But once again, in BLS, how would you know the name of the person that's on the floor? No, let's not call him Michael. Are you okay? Are you okay? That's how we're gonna go. Okay, next is S, shout. You know that potential energy you always had in your heart, you finally get to use it. You have to shout. You have to say on your left, on your front, and the right. Help, help, and help. Okay, so just like I'm teaching you, you will be teaching that student in front of you. Alright, or your junior. Alright, so you shout for help. Next is shout. Next is the ABC approach. Alright, what is the ABC approach? A, check the airway, check the breathing, check the circulation. But you're not going to do this in the form of a long, like you did in the SIMAN cases, where you did airway, you went through so many things. No, this time we're going to do a quick one. How do you do a quick analysis of airway, breathing, circulation? You perform a head tilt, chin lift maneuver. Alright, pause. You perform a head tilt, chin lift just to make sure the airway is patent. So if you see, I press the forehead back and I push his chin upwards. I look in his mouth for any foreign body. If I see it, I remove it with my little finger, only if I see it. So you quickly perform the airway maneuver. Then you assess for signs of life. How do you assess for signs of life? You bring your ear close to the patient's mouth. Pause. Performing head tilt and chin lift, what you need to do is put your ear to the patient's mouth. You check for breathing. What are you doing? You're looking, listening, and feeling. What are you looking at? You're looking at the chest rise. What are you listening for his breath sounds? What are you feeling? The warmth of his breath. You need to assess if he's breathing, and see for circulation. You need to put your finger on the carotid while you're performing some chin lift, looking, listening, feeling, and carotid. A, B, C. All three things together are in check, but this shouldn't last more than 10 seconds. So keep that in mind. In 10 seconds, you have to assess what? If he's breathing, if he has a pulse. To recap, we go through these for 10 seconds to assess. Basically, what you're trying to do is assess for signs of life. Because the indication for a CPR or to begin a BLS is the no signs of life. So the moment you've confirmed in 10 seconds, don't let this be longer than 10 seconds, that this person is not breathing, does not have a pulse, you have to begin the CPR. Now CPR is the most important part that you need to teach the student, is that what you need to do is bring both your hands, the dominant hand over your less dominant hand. Could you come close? It is the lower part of his sternum that we need to compress. We put the heel of our non-dominant hand on his lower half of sternum, because you need to teach this and you need to say it exactly. Now watch, your hands should be perpendicular to your shoulders. Everything should be completely straight to his chest. And then you perform depth of compression being 5 to 6 centimeter, 100 to 120 per minute, the rate. Alright, so rate is 100 to 120 per minute. 5 to 6 centimeter is the depth, which is 1/3 of your chest. And make sure the chest recoils after every compression. So you have to perform 30 compressions to 2 breaths, 2 rescue breaths. So you're going to show to the student or to your junior how to do it. You need to demonstrate it. So this is how we're going to perform CPR. Alright, so you have to demonstrate it. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. The moment you perform 30, you go to give your rescue breath. To the student or to the junior, you tell him, take out a pocket mask if you have one, you put it around his mouth, you make a seal and you blow. You don't need to blow in the mannequin. Alright, you just need to tell him, you blow, you give 2 rescue breaths. Each breath should be over 1 second. So it shouldn't be, no. You know, like a normal breath, otherwise it can lead to other complications. So you are going to be telling him this. And then you go, continue to perform CPR. There should be as less of interruptions as possible. Okay? One more thing, guys. A little bit of a small part that I've missed. Make sure before you perform CPR, you've called for help. Call for help. Okay, like as in call for help as in 999. Please someone dial 999 and then perform the CPR. Alright, so this is the CPR. Now, while you're performing CPR, someone should be getting the automatic external defibrillator. And when do you stop the CPR is the question. You stop the CPR when either an ambulance has arrived or you are exhausted or the external defibrillator is here. And the external defibrillator should be attached to the person, and make sure nobody's touching the person when the defibrillator will assess rhythm. When the defibrillator will assess rhythm, it will decide what to do. It will give a shock if required. And once the defibrillator part is over, you have to continue your chest compressions, same 30:2 until help arrives. So this is what you're going to be teaching to the medical student. Alright, now let's go through this one more time. For instance, there's Michael. Michael is our student. Michael, you're not dead. Michael is the student that's come to learn. So how do I approach this station? Hi Michael, how are you doing? How are rotations going? I hope everything's going good for you. You know, I've seen you around and I also understand from my notes you want to learn a little bit of the BLS. Is that right? Any particular reason you're looking to learn this? Alright, and can you tell me what you already know about BLS? Okay, that's great Michael, that's excellent. So, is there anything particular you want me to go through? Any special step that you're more interested in? Maybe he says CPR. Okay, Michael, I'll keep that in mind. And, okay, Michael, here's a little bit of a test. Do you know when we do CPR? And Michael tells you, alright? Whether he tells you or not, always begin. Okay, let me tell you, Michael, first things first, every teaching scenario should be started by telling the basics to the person. BLS means basic life support. Even if he knows what it is, but a good teacher is the one that starts from ABCs, right? So BLS is basically a basic life support. This is something you should know. Everyone should be trained for it, because at any time someone can fall and you need to assess if the patient needs CPR or not. So BLS teaches us that. What are the signs to look for? All right. In basic life support, usually we do it. When do we do it? We basically do it when someone has undergone cardiac arrest, which is cardiac arrest and respiratory arrest, both of the things. Okay, how do you assess that? We will assess it when we go close to the patient and check signs of life. Alright, so Michael, how about I go through the entire checklist you need to go through when you're going through BLS? Is that okay with you, Michael? So first thing, you need to look at the danger. You need to make sure you are safe, patient safe. Next thing, you check the response. You shout, are you okay? Are you okay? Then you shout for help in 3 directions like this. Help, help, help. Once you've done that, at this point, you will do your airway, breathing, circulation. Check, look, listen, feel. 10 seconds, I do not see any signs of life. I would like to initiate CPR. Someone call 999 CPR. Alright? And then you tell the student, I will approach to tell student that this is how you perform CPR, the way I taught you guys. Alright? So that entire checklist you're going to tell. Now what you're going to do, okay, Michael, now that you know the entire protocol, I want you to perform the ideal chest compressions for me, ideal CPR for me. You ask them to demonstrate it, and once they've done it, well done. So Michael, maybe the time is less right now, but how about we set another meeting and I'll tell you more advanced things about this. So alright, Michael, all good, do you need any questions? And then you thank the patient. Patient, sorry, doctor or the junior. Alright, just one more thing before we leave. Quickly going over the pediatric, could you bring it to the board? Just in the pediatric BLS, I want you to change a couple of things. One of them is, in pediatric BLS, you need to remember that you will do 5 rescue breaths before you begin the CPR. Simple as that. And your chest compressions will be 15:2. Your depth in infants, less than 1 year is an infant, depths in infants should be about 4 centimeter. Depth of compression in children more than 1 year should be 5 centimeter, because obviously we can't do a 6 centimeter in these, right? And apart from that, the way you do the compression is going to change. In infants, you do the 2-finger method on the lower part of the sternum, alright? And in bigger children, you go through the heel of one hand, and that's how you perform. 15 and then 2 rescue breaths. So if it's a pediatric BLS teaching, you just change everything I said, same thing, same protocol, just change a couple of things right over here. Alright, so this is all for BLS teaching. Thank you all for watching. Stay tuned.